Good evening, everybody. Thanks for coming. I'm David Roberts, the president of North Shore Medical Center. Thank you for taking the time out of your evening to come listen to what we have to say and then participate in the health needs assessment plan we have tonight. I do want to recognize our mayor, Tommy McGee. Tommy, thank you very much for coming. Tommy's been very involved in this process from the very beginning, so he's not new to the planning that we've been doing around this. So the sequence of the evening is I'm going to go through our plans around the reuse of the Union Hospital campus and the exciting plans we have around building this medical village that some of you have heard about. And then the folks from HRIA are going to do a presentation about the health needs assessment for Lynn, and then I think they'll introduce the plan they have to break off into small groups and talk to you all about your perception of what we need to do to provide for the health needs for the citizens of Lynn. So that's going to be the participatory part of the program. So again, thank you for sticking around and helping us plan what we need to do for the city. So some of you have seen some of these slides before, but I want to take you through how we got to the plan that we're now in the process of developing. So I think I just said everything on that slide, which is pretty good. So this is, once the decision had been made to consolidate inpatient services on the Salem campus, a group was formed to help decide what are the resources we need to invest in Lynn to provide for the needs of the people of Lynn. And so we put together a planning group that its purpose was, what resources do we need to put here? We've had two prior public forums, and I think at the last one we presented this concept. This is the Emergent Urgent Care Planning Committee that has met, I think, 6 or 7 times so far over the past 2 years. You can see that there's representation from our elected officials, advocacy groups for the city of Lynn. The EMS community is represented on this group as well. There's our chief of emergency medicine, chief of internal medicine, and Dr. Mitch Ryan, who's a senior VP. So lots of representation from the medical center, from elected officials, from community advocates, and from the EMS community. And this was our charge, was to meet the emergent, urgent healthcare needs of the greater Lynn community, be considerate of the way healthcare will be delivered in the future, and be clinically and financially sustainable to ensure that the service will remain in the community for the long term. So that was our job, was to come up with a plan that met all 3 goals. So just a couple of data points that I want to explain to you, which is one of the first decisions that this group had to make was, were we going to do a long-term emergency services in the city, freestanding, unattached to a hospital, or were we going to provide urgent care? And part of what we did was to figure out what type of patients were coming to the Union Hospital emergency room. And the way you categorize patients is from the very sick, which is levels 1 and 2. These are patients with life-threatening emergencies such as cardiac arrest, stroke, overdoses that need the services of a full emergency room and a full hospital. Level 3, or those are sort of in the gray zone. You don't really know until you finish the workup as to whether they're going to need to be admitted or they can be stabilized and go home. And levels 4s and 5s, these are patients with illnesses requiring care but never get admitted to the hospital. These are often things like coughs or strep throat or sore throats or my leg hurts, I don't know why. They come in, they get evaluated, often with minimal use of x-ray and labs, and then they go home. And so what we did was we looked at all the patients in the last few years that came into the Union Emergency Room to see which bucket they fell into, so we could then figure out what are the facility we should build to meet most of their needs. And so this is what we found, was that of the total of 21,000 patients that came to the Union ED, about 3,700 were sick, and 7,000 or so were levels 4s and 5s that had minor complaints that could be cared for either in their physician's office or in an urgent care facility. And then there was 11,000 in the middle. We then did a deeper dive on those 11,000 and then categorized 12,000 of the 21,000 could be treated in a lower intense situation like an urgent care. The benefit of being treated in urgent care, if any of you that have been to any of our urgent care facilities, is that you get, in general, expert care much more quickly with much fewer little wait and at a much lower cost both to you and to society. The out-of-pocket expenses are much less at urgent care than going to the emergency room. So we figured about 12,000 of these patients could be seen in urgent care, and about 8,000 would be best served at a full emergency department. So from this analysis, we decided, the group of all those participants decided that building a urgent care facility on the Union campus would be the cornerstone of the investment in the city. The idea that these 8,000 patients who turned out to be ill, a significant percentage of them, if they came to a freestanding emergency room, would end up being transferred to a hospital where they could get their full care. And so for many patients, if you're in levels 1 and 2, going to an emergency room unattached to a hospital is a delay in care. So the idea would be these patients would come to the Salem campus where there's a full-service hospital, where there's the expertise and the infrastructure to take care of them. So this was the analysis that led that group to decide that urgent care would be the best building block for care in this community. We then, again, spoke to many constituents and came up with the idea that an urgent care facility that's embedded in a medical village, and a medical village in our construct would be anchored by a large primary care practice. In addition, specialty services, behavioral health services, and support services like blood work, lab tests, antibiotics, and X-ray, ultrasound, and bone density. The idea is there's a practice in the West Building on the Union campus of 11 primary care physicians. That building is old. It needs a lot of renovation, and it's attached to the rest of the building, which we'll talk about in a second. So the idea was to move that very thriving practice into this building, expand it by another 3 to 5 primary care providers, and then co-locate them with specialists, behavioral health professionals, and all these other services. And it really gets to this idea of one-stop shopping. You go to one place for the vast majority of your healthcare needs. This is a schematic that speaks to how patients use the Union campus today. So if you start at the bottom, the vast majority of patients go to the Union campus today for outpatient visits, lab tests, x-rays, and EKGs. The next big group is for primary care. The next is for ED non-emergent visits, which could be taken care of in an urgent care facility. The next 11,000 is specialty doctor visits, 10,000 for outpatient behavioral health visits, and then you get up to this 4,000 total patients on a yearly basis using inpatient services. So what we're proposing is right up to this line, taking care of 90+% of all the current healthcare needs of people that go to the Union campus today will be taken care of in the new facility. It's this top bit that will need to go to Salem to access the higher level of care. And so the majority of services will remain on this campus. So the majority of people that come to Union Hospital today for care are going to come to this new building for care. It's just the patients who are really, really ill that need to have the acute care will go to the Salem campus. So the reason why I like this plan so much is the majority of people that come to the Union campus for care now are going to receive care in a much better place. Their urgent care will be delivered much more rapidly, much more cheaply for the patient, and all of the doctor's offices will be upgraded. It'll be just a much better place to receive care, all in one location. So it's the same care, but in a much better delivery model. So I think that's really the big improvement in how people are going to get care in this community, in this facility. So this is our current plan, is to place this new medical village in this space. Right now, those of you that know this campus know that there's 2 small buildings underneath this building, and so they will have to be taken down in order to build this. And the idea would be all of this parking and then all of this backlot parking would be part of this facility. This is 5 acres or so, and this 15 acres from here over, this is the part of the land that is going to be repurposed. So let me just talk a little bit about that process. Currently, and the mayor's here to correct me if I get this wrong, this is all zoned for single family at the moment. That's what it's zoned for. We've not yet had any proposals for reuse of this facility. I am asked constantly, oh, I hear it's going to be a this. I hear you sold it to Y. So we've not even sent out a proposal yet to anybody. So there's no preconceived notion of what this space is going to be. But the first step is for the city to decide, do they want to rezone this, yes or no? That's in the mayor and others' hands to figure out what's the best use for the city. And then once that thing is decided, we're going to put out a request for proposal to developers, and there'll be input from the mayor and others as to those proposals, how do they meet the needs of the community, and they'll get vetted as they come in, but we haven't even asked anyone to weigh in on the subject of what this land is going to be. I think this process has been pretty transparent, involving lots of stakeholders. We're not doing this alone. We're in a partnership. So the idea is this will be the new medical village. And this is a schematic of what it might look like. This is 37,000 square feet, roughly. The cost of this building is about $24 million that North Shore Medical Center is spending to build this. So I'm pretty excited about what this is going to be and what this is going to do for the city. This is where I've been a doctor in the Lynn community for 33 years. This is a major advance in how to deliver care in the city. So I'm pretty excited about that. So since the last public forum, Partners has approved. Partners has said that North Shore Medical Center, we can spend our money on this project, so that was great. We're excited about that. As I said, we're working through the zoning and permitting around that. We do have an architectural team involved with the design of the hospital, design of the medical village right now. We haven't seen any initial diagrams yet for this, but we're in the process of doing that. And we filed with the land court to deregister the land. Takes 3 to 6 months. It makes it easier if any of the proposals that come in have a subdivision part of that proposal. Again, we don't have any proposals yet, so I don't know what they're going to say. But that's where we are right now. So the money's been allocated, the architect's involved. We have a planning group that's meeting weekly as to make sure. Now, the reason why there's some urgency to this is in the fall of 19, when the inpatient services here moved to Salem, and the plan is for the emergency room to close at that time. We need to have an urgent care facility built on this land before we close the emergency room, because even though the new emergency room at Salem is going to be large, it is not large enough to take all 21,000 patients from the Union ED into the Salem ED. We need to have an urgent care facility built, open, and running on this campus so the 15,000 patients that are going to use it for urgent care have a place to go. So we're kind of under the gun that in a year and 6 months we've got to have a building up and functional. So we're picking up the pace to get that up and running. So it's open on the day that we move this emergency room to the Salem campus. So that's most of what I know about what we're doing. I'm really interested in answering any questions people might have about that before I turn it over to the health needs assessment part of tonight's program. So there's a microphone here.
I just have a question about the zoning, that you said it was zoned for single family where the hospital is?
Right.
Is that what you said?
Yeah.
It's not single family now, though.
No, but so help me out here, Mayor. If we're going to reuse the property.
It was a special permit to put the hospital there, but it is zoned for single family, the whole site. So we're in discussions about what the right zoning would be. And I just want to make the point clear. As we move forward with the zoning, we want to make sure that everybody in the neighborhood and the community, especially in Ward 1, is part of this larger discussion about what's going to happen related to the rest of the property. The key piece is finding a way to zone it so that the medical building can be moved forward, and then we're going to continue discussion on what the rest of the site will look like. But that's going to be really important for all of us to be part of that discussion. So that's where it stands. The zoning piece is to take a look at the zoning so we can move the new medical facility forward, and then put the zoning in a way that allows us to then have a broader discussion about what that site will look like moving forward. And again, we want to make sure that the community feels comfortable, that your voices are heard, and that we're going to have an ongoing discussion together to resolve the 15 plus acres, about 15 acres. Right. It's about five and a half acres on the site where the medical building will go, and then there's about 15 acres, about five and a half acres where the current bigger building is, and then the parking lot entails about 9.5 acres, which is in the back, behind across the street. So that's pretty much all that.
My question, I really have two. One is, as the mayor said, there's going to be required changes in zoning and that for whatever plans go forward. And I looked at your list of people involved in that, and it's been my impression right from the start, including the health planning that was originally done by partners, that there's basically been absolutely no involvement of the people in the neighborhood for partners' plans to close the hospital, partners' plans for the future. And along the same lines, if you could elaborate on exactly what the difference is between the urgent care facility and the emergency room. I mean, I'm one of many of the people living in the city of Lynn who have benefited from great care at the Union Hospital emergency room. If it wasn't for that, I probably wouldn't be standing before you, but I feel that we've received great care in the emergency room in the past. We've had a full-service hospital at the site, and now we're basically being deprived of both. And I like what I hear about having some medical care available, but as a 74-year-old who, if I have another major event, hopes to survive that, I think about the thought of going from where I live up on Judge Road to Salem Hospital, and I don't like my odds of making it. Union Hospital is not just a convenience to the city, but to me it was a necessity. We lost Lynn Hospital, and now we're losing Union Hospital, and I see it as a slap in the face to people that want to live a good life and want to survive, and we're getting excellent care at Union Hospital. It went from having the highest rating for occupancy in the state. That goes back a ways, but they did have the highest occupancy rate in the state for many years, and down to not having a great occupancy rate because there were no services available, because they were all being gradually moved to Salem Hospital and to other sites. And I'd just like you to address mainly the difference between urgent care and emergency care, because I hope I don't need emergency care,
Right.
but I think it's likely I will at some point in the future. Thank you.
Thank you for the question. So the issue with a freestanding emergency room is a couple of things. One is, if you have a freestanding emergency room, you're allowed to take ambulances, and something like 25% of all ambulances that go to freestanding emergency rooms, which, by the way, are not licensed in the state of Massachusetts at the moment. 25% of patients that get brought to a freestanding emergency room in an ambulance have to get back in an ambulance and go to another place because there's no services in-house. There's no surgeons, cardiologists, gastroenterologists, pulmonologists, intensive care. There's none of those things in-house. So you go there, they stabilize you, and they got to transfer you somewhere else. And the group, so that's one. Number two is it's about $10 million a year more expensive to run. And so the viability of running a freestanding emergency room is not very good care, in my view, and fiscally irresponsible. So it didn't meet either of the criteria that we had set up when we formed the committee, which is it's got to be fiscally responsible and it's got to be good care. So the idea that if you're in an ambulance and you're sick, you should go to a hospital where the facility can take care of you, where there's operating rooms upstairs and there's surgical residents in-house and all hospitalists in-house, all of the things you need when you're ill. So if you're really sick and you go to a freestanding ED, you don't have anybody in-house to do much more than stabilize you and transfer you to a full-service hospital. So the advantage of urgent care is those patients don't go to urgent care. Ambulances don't go there. Desperately sick people don't think, I'll go to urgent care. They call 911. They get transported to a full-service hospital. So it was a unanimous decision of the planning committee that urgent care made sense financially and clinically, and that a freestanding emergency room didn't make sense clinically and didn't make sense from a financial point of view. And by the way, it's not a model that the state of Massachusetts really embraces for those reasons. So that's how we ended up with urgent care as the best. I mean, in my view, urgent care is where you go when you're not very sick. If you're sick enough to go to a hospital, you want every single resource at your disposal when you're that sick. Going to an intermediate place is the worst of both worlds. You don't get quick service, and there's no resources in-house to take care of you desperately ill. That's why we moved on from that as an option. And as a cardiologist, I endorse that. You don't want to be going to a freestanding emergency room having a heart attack. It's not the place to be. Hang on.
I'm just going to read a little something. So the current plan, as we understand it for North Shore Medical Center, to zone off the Union Hospital building and the majority of the parking spaces is to sell it to a developer. A smaller space will be kept by NSMC to build a new physician office building, NSPG. NSMC is calling this a medical village. The proposed medical village represents a small fraction of what Union Hospital has provided to the people of Lynn and neighboring communities every day for many decades. Union Hospital has cared for all the people, regardless of ability to pay, who their insurer was, and also what system his or her doctor may have been affiliated with. When the Union Hospital building and remaining parking spaces zoned and sold to a developer, the purpose of this sacred space should be to provide health care services. Physicians and other providers that are not affiliated with partners NSMC, NSPG should be allowed to open practices and provide health care on this site. NSMC, NSPG, and Partners Healthcare should never be allowed to restrict the entry of other providers onto this site or anywhere else in the city. We should not be limited to just NSMC, NSPG, or Partners Healthcare providers. We, as citizens and leaders and politicians, must ensure that we have the freedom to choose who we care our health care from. If the Union Hospital campus blossoms into a place where there are multiple choices, multiple providers, multiple services, then perhaps we can call this a medical village.
So can I ask you a question? What providers do you think we should have on this campus that we're not providing for?
I think anyone. I just want to make sure that anyone is able to.
Okay. Thank you for those comments. Other thoughts or questions? Oh, we got to move along. You're the last one. I'm getting the hook.
It's like a two-part question.
Okay.
First, the number of patients that you're referring to, for the emergency care, did that reflect only Lynn residents? Because we've got
No, it's
peripheral,
everybody. It's
Saugus,
Yeah. It's just the number of people.
Peabody. I mean,
It's not where they live. It's not where they live. It's the total number of patients who came to the emergency room, 21,000.
because the number of people
Yeah.
in the surrounding, you just can't say 93,000 people.
Right.
You're well in excess of that,
Yeah.
which I'm sure you appreciate, and it makes it more difficult for those patients in the peripheral area to get to Salem.
Yeah.
Oh, find a place to park, cruise around for 25, 30 minutes, and then have to walk until, you get lost again. Okay.
We're
And-
going to fix that.
Good. Yeah, because it takes 35 to 40
Yeah.
minutes to get there when it takes
Yeah.
15 minutes to
Okay.
get here. Okay. And secondly, as far as encroachment on the, I don't know if Lynn Woods comes up to that, is that going to be protected for any expansion that you're going to be doing?
Lynn Woods won't be affected by what we build, the medical village. I can't comment on the developer side of that question. I don't actually know where the Lynn Woods line is. Does anybody know?
I think that, I'm not sure that parking lot in the back is like it was, because there's residential behind it, so.
Yeah.
Okay. I was thinking just that, not with like the employees' lodges,
No,
but
with the
the
parking lot
other
is.
side. Yeah,
Yeah.
yeah.
And again, that would be part of a larger discussion.
Right.
With all of us about what we want to go there, whether it be other medical facilities or other ideas. That's going to be something where I think we need to really have a robust discussion about what needs to go there. Again, that's about 9.5. I'm not even convinced the 9.5 acres is actually fully buildable. We have to figure that out.
Right. Yeah, well, thank you, everybody, for your attention and interest in this. As I say, I'm really excited about what we're doing in the city of Lynn. Thanks.
We are here from Health Resources in Action, and we're going to transition now to telling you about the Community Health Needs Assessment. So I'm just going to pull up our slides. All right, can everybody hear me okay? All right, so I'm here from Health Resources in Action. We are a nonprofit public health organization located in Boston. My name is Kristen. This is my colleague Erica. And we are here to tell you more about North Shore Medical Center's 2018 Community Health Needs Assessment and to ask for your input on this process. So first, I'm going to just tell you a little bit more about our process and what is a Community Health Needs Assessment. And we're going to share a little bit of data with you. And then we're going to break into small group discussions because we really want to save a lot of time to hear from you tonight. And so we have been hired, my organization, Health Resources in Action, by the North Shore Medical Center to support their 2018 Community Health Needs Assessment. And so we've worked on needs assessments like this both locally here in Massachusetts as well as other areas of the country. And in addition to myself and Erica, we have 10 of our colleagues who are kind of in the back corner of the room here tonight, and they'll be helping out with the small group discussions. So first, we wanted to start by talking about what is a community health needs assessment and why do we do them. So we're approaching this needs assessment with North Shore Medical Center really as a great opportunity to learn about the health-related needs in the community. So just now, earlier tonight, we did hear an update about the medical village. And I just wanted to note that the assessment that we're working on is broader than just the plans for the Union Hospital campus. Although we do recognize that this is, of course, an important part of the context when we're talking about health needs in the community. But for this assessment, we want to learn about health assets and health needs really throughout the whole community. And so in our conversations, we'd like to think about health broadly so that we don't miss anything. And I'll talk a little bit more about what I mean by that, about thinking about health broadly. So for this community health needs assessment, there are 4 main goals. The first is to provide a picture of the health-related issues in the community. The second is to identify health needs in the community, as well as community strengths and resources. The third is to describe issues that affect the community overall, as well as whether there are any concerns for certain groups or certain vulnerable populations. And then the fourth goal is really to provide data that can be used to plan and develop programs. And this assessment also meets some federal requirements for North Shore Medical Center. They conduct these types of assessments every 3 years. So we're approaching this process through a really broad lens of health, recognizing that where we live, work, and play all have a significant impact on our health. And so I know this image might be hard to see for some of you in the back, but we'll kind of walk through it. Really what it's showing is that our individual factors, like our genes and our age, they're just one of many things that can affect our health. So this image is just showing that there are other layers that can affect our health, like the choices that we make, our community networks, where we live, where we work, and other socioeconomic factors like income and employment. So in this needs assessment, we want to think about not only individual factors like your genes or your age, but we also want to think about larger social and economic factors like employment, education, housing, and working conditions. And these larger factors, they're sometimes called social determinants of health. So when we break into the small group discussions tonight, we really want you to think broadly about health, not just whether people are sick, but also what are some things that impact your quality of life and make a community healthy. So for example, if someone is living in housing that has mold, and if they have asthma, they might have trouble controlling that asthma no matter how many times they go to the doctor if where they're living has mold. And so when we do these types of assessments, we hear about diseases, but we also hear about things like access to healthy foods or safety or noise or even trash. It can really be a lot of broad things. And so we want to take all these things that can affect your health into account. So we wanted to just walk through what are we doing as part of this assessment, how are we going to gather this information. We're going to look at several different types of data to learn about health needs. The first thing that we'll do is review existing data on health issues as well as social and economic issues like housing and employment. And so this data comes from sources like the US Census and other sources that already exist. And we're going to share a little bit of this data with you tonight. And so knowing those numbers is important, but it definitely does not tell the whole story. So we don't know the why or the how behind the numbers. So we might see that a certain percentage of people who live in Lynn don't exercise, but we don't know why that is, or we don't know what could be done about it. And so in the assessment, in addition to looking at data, we really want to learn about what people view as the health issues in the community here, as well as what they view as the strengths, and what would be your vision for the future of the community's health. And so to fill in these gaps and add to the numbers, we're going to be engaging community residents and stakeholders in the assessment process. And so tonight really is the first step in that. And so we're so glad that you all are here, and we hope that you can stay for the small group discussions. So we will move into those after this brief presentation. In addition to these conversations tonight, we're also going to be doing 6 focus groups with community residents and stakeholders, as well as 15 interviews with key leaders and stakeholders in the community. And then we'll take all of that information and we'll put it into a report, and we'll also present the results. So our timeline for doing all of this, we are collecting all of the data and having all these conversations through March. And then we will analyze the data and we'll develop a draft report. And then we are really excited about this. We're going to come to another meeting like the one here tonight, and we're going to share our preliminary draft findings with you. So this will be a chance for us to tell you, this is what we heard, this is what came out of the assessment, and to ask you, did we get it right, or did we miss anything? And so we'll be looking for your input again when we come back to share those draft findings. After we share the draft, we will work with the North Shore Medical Center to finalize the report, and it'll be posted online. So it's something that the North Shore Medical Center can use, but it's also something that any other stakeholders in the community will be able to use to help inform their program planning as well. So my colleague Erica now is going to share a little bit of existing data with you about Lynn and the North Shore area. And we're going to show you data just on a few topics, just to provide some context and kind of get the conversation started for the small group discussions tonight. Our final assessment report is going to include a lot more data, but we won't show it all to you tonight. We're just going to show you a little bit. And as I mentioned, these numbers are important, but we really are looking forward to hearing from you about your experiences when we move into the small group discussions. So Erica, I'll turn it to you.
Hello, everybody. So thanks, Kristen. Before we dive into some of the data, we wanted to mention a few of the limitations that's often associated with some of this work. So first and foremost, it's often challenging to get data at the local level, and this is especially true for smaller communities. When we do have data in some of these smaller communities, it's not always current, and so we really have to work with what we have. And lastly, we use a lot of different data sources, like Kristen mentioned, and some of those are based on self-report, which means that participants are completing a survey or a questionnaire, and they can often under-report or over-report. But despite some of these limitations, we really try hard to take a comprehensive look at community health by looking at a number of different factors, health indicators and socioeconomic demographics. And so we're going to share some of those with you tonight, but as Kristen mentioned, what we're really looking for is hearing your experience, because you are the experts of your community. So as far as where our assessment focuses, we're looking at the following 8 cities that are highlighted here in blue. We're not going to be showing you data on all of the cities, and because we're in Lynn tonight, we're going to be focusing on a little bit more data from the Lynn community and some of the bigger cities in the catchment area that North Shore serves. So as Kristen mentioned, our assessment looks at both the numbers that tell us a little bit about what is happening in the community, and we also want to hear from the interviews and focus groups of the how and the why these things are happening in the community. So we are in our early stages of doing some interviews and focus groups, and already what has come up are the various strengths and assets here in the community of Lynn. So as one interview shared with us, we live in a vibrant, immigrant-defined community. Most immigrants are incredible risk takers and very entrepreneurial minded. That energy, ambition, and drive is remarkable. Something that we heard as far as the nonprofit sector goes is we heard that there's true collaboration among many of the social services in the community. Our relationships are strong and productive. So this is just an example of some of the many strengths that we've been hearing and as part of the early interviews and focus groups that we've done. So as far as the number goes, first we want to look at demographics, like things like population, to understand a little bit about who lives in the community. So when we look at total population between the 8 cities that we're looking at, we see that Lynn is the most populated community, followed by Peabody and Salem. Next, we look at things like age distribution. And so you'll notice here that about 21% of Massachusetts residents are under the age of 18. Lynn actually has a quite younger population, with about 1 in every 4 residents being under the age of 18. As far as racial and ethnic diversity, we do see great variation across the North Shore communities. But when we look specifically at Massachusetts as a state, we see that about 74% of residents identify as white. When we look at Lynn, we see that that number is significantly lower here, with more than half of the residents in Lynn identifying as being non-white. Again, thinking back to our interviews, this was something that was mentioned as quite a strength that could be leveraged, the diversity in the community filled with lots of cultures and lots of languages. So it's no surprise that when we see those demographics and we look at things like language, we see that the percent of residents who speak a language other than English at home varies greatly across the community, with half of the residents in Lynn reporting that they speak another language at home, compared to about 23% of Massachusetts as a whole. So next we start looking at things like income and poverty. So as Kristen mentioned, we know that health is related to a lot of things. And so when we look at a community's health, we often look at indicators like income and poverty to see where different communities lie. And you also see a great variation among the 8 cities that we're looking at for the health assessment. In particular, we see that Lynn has about twice as high as a percentage of families living in poverty compared to the state of Massachusetts at around 8%. We're also interested in how folks use different services, including transportation, to see how that varies across communities. And so when we look at Lynn, we see that about 13% of residents rely on public transportation to get to work, followed by Salem at about 11%, but it varies greatly across the communities. So once we've taken a look at a lot of those socio and demographic data, we start taking a little closer look at chronic diseases. So an example of some of the chronic diseases that we look at are obesity. So here you can see that North Shore residents have a slightly higher percentage of children who are overweight or obese, higher than the state of Massachusetts. But the rates are pretty similar if we look at the North Shore area alone. Other chronic diseases that we look at are things like diabetes and cancer. So if you'll notice this chart on the left, we see that Lynn actually has a slightly lower percentage of residents who have diabetes at 5.8%. And the opposite is true for residents who are diagnosed with cancer. That has a slightly higher rate than the state overall. We also look at things like teen birth rate. And so you'll notice on this graph that Lynn has a higher percentage of teen birth rates, and so this graph is showing us teen births ages 15 to 19 per 1,000 residents. What's not said here is that we have seen this teen rate declining since about 2005. We've seen that the teen rate pregnancy has fallen in Lynn. So we're also very interested in looking at different substances in the community. And so our assessment will show things like alcohol use and tobacco use. But for tonight, we wanted to focus on opioid use, since we know that that's a major concern, not only across the state of Massachusetts, but the country in general. So we're showing a similar trend across the state of Massachusetts. We've seen that opioid-related deaths have nearly tripled since 2012. We see this similar trend across the North Shore. So this chart is showing us the number of opioid-related deaths, or the count of opioid-related deaths. So you'll notice that Lynn has a higher number of deaths than Peabody and Salem, but we often expect this to be the case in more populated areas. And so Boston has a higher number of residents, Worcester has a higher number of residents, and so does Lynn. So we would expect those counts to be higher in the more populated cities. So the last data point that we wanted to share with you is premature mortality. Premature mortality is when somebody dies a little earlier than expected, and it's often a good indicator of community health. So we'll show that the number of premature deaths in the North Shore are a little higher than Massachusetts as a whole. So as Kristen mentioned, this is definitely not an exhaustive list of data, but we wanted to give you a flavor of some of the things that we look at in our assessment. Everything ranging from who lives in a community, what they look like, to some of their health topics. So I'm going to hand it back over to Kristen, because now we're going to get to the real meat of our discussion, because we want to learn from your experiences and hear what your priority needs are.
Thanks, Erica. So just in the interest of time, to make sure that we devote enough time to the small group discussions, and now that you've kind of seen a sample of some of the data that we'll be gathering as part of the assessment, we're going to break into small groups now to really ask for your feedback on the data that you've seen so far, what you've heard, as well as what you view as the important health issues in your community. And so, as I've mentioned, community health, it can mean a lot of things. It can mean diseases and illnesses. It can also mean other things that affect your health, like transportation or housing. And so in the small group discussions, we'll talk about health broadly. And so we're going to take about 30 minutes for the small group discussions. We're going to go until about 7:30 or so. And we will do, after the small group discussions, we'll have a chance for each group to share 1 or 2 key points that came up, so that everybody in the room can hear about, what the other groups talked about. And so just to break into the small groups now, I think we're going to ask you to stay where you are. Our facilitators are going to come to you. I'm looking at my colleague Valerie, who's helping me facilitate this split out.
You're going to break out into 6 groups of about 8 to 10 people per group. So what I ask is that if you're at a small table, maybe 2 people, you move to a table where you see some open spots.
Great. So I'll just repeat that. So we're going to have 6 groups. And so if you're at a group with a lot of people, stay where you are. If you're at a table with just a few people, please join another group. We also wanted to mention that we do have an interpreter here tonight if anyone speaks Spanish and would like to have interpreter services. And I'm going to ask Lorena to just make that announcement in Spanish as well. Thank you all so much for taking the time to participate in these small group discussions. We do want to make sure we save some time to have each group report out a couple key things that you all talked about so that everyone in the room can hear, what the other groups talked about. So I'm going to walk around with a microphone to each group and ask a volunteer to report 1 or 2 key things. So does any group want to start? Does anybody have some burning issues that they would like to share? It'd be the first ones. Valerie's group. All right.
Good. Hi, everybody. I'm Michelle from Lynn, and I live close to Union Hospital, but we won't go there today. Some of the issues that my group spoke about, we spoke about the opioid epidemic in the city, and with that, also we added substance abuse with the alcohol, physician prescribing, dentist prescribing, all the different pain medication that we have. Also was a transportation issue for getting from here to Salem Hospital, accessibility of the care, the cost that it will cost the residents to go from here to Salem. Accessibility of fresh foods. There are community gardens in Lynn. There's also a farmer's market in Lynn, but it's more downtown so that the people who are further away don't have access to it. And mental health issues. That there aren't enough mental health treatment centers available or physicians available to help treat mental health. That's what we discussed.
Thank you so much. All right, so I'm going to go to the next group, to Judy's group over here. Great job. Thank you for sharing. Does your group have a volunteer who wants to share some of the key things you talked about? Voluntold.
Hi, my name is Joe Zukas. I'm a captain on Lynn Fire, and I'm in charge of the ambulances for Lynn Fire. I'm the EMS director for the city of Lynn. I think this is an important issue because the amount of ambulances we're going to have available to treat you or go to your home when you call 911 is going to be severely curtailed because all our ambulances are going to be going to Salem Hospital or Beverly Hospital or Melrose Wakefield, wherever is the appropriate place. So the turnaround time, I've lived in Lynn for 52 years, is Highland Ave is, I don't have to tell you if you traveled Highland Ave. So our ambulances right now go to Union or Salem, they're back in service fairly quick, especially the ones in Union. That is not going to be the case. So I worry about the beefed up services of Lynn Fire Department and of Atlantic Ambulance, because when you call 911, those are the resources you're going to get. And so that, I think we have to think about that. It's important. We want to be able to, when you call 911, we want to be able to get to you, have an ambulance available to you as quickly as possible. That might not be the case as you currently enjoy right now when this all happens. Which goes in the other issue is education. I know Partners wants to, or North Shore Medical Center wants to educate people when to call 911, and a lot of people that use Union Hospital probably could be seen at their primary care physician or at this this medical village, which is great. But a lot of the people in Lynn don't speak English, they're poor. A lot of times an ambulance ride is a taxi ride because for no other way. So educating the community on how to be healthier, when to use 911, all the other things is going to be very important for their quality of health, the health care and everything else. And we did talk about the opioids and mental health. That's a big issue. We had 400-something overdoses last year and 65 deaths. So that's still going on right now. So these are all important issues. Yeah, and where to put the services, is it going to be up here in Ward 1? Is it going to be downtown where most of our calls are from the downtown area, so, okay.
Thank you so much. It sounds like, some similar things here and some new issues as well, so thank you so much for sharing. I'm going to come to Daisy's group. Do you guys have a volunteer who'd like to share? Great.
Hi, I'm Dave Solomini. Know probably half the people in the room. But the primary thing that we talked about was that, for us, we have cars, we live in single-family neighborhoods. Access to health care is relatively easy for us and has never been a challenge for us. We talked a lot about, the immigrant population in Lynn, where you've got, Lynn was talking about, 10-year-old kids that are translating for their parents and trying to access health care. So that we know that there's a challenge for a lot of immigrant families, some of them single-parent families, that the parent has to go to work, the child needs health care, so that access to health care in the immigrant population in Lynn, and looking at the statistics where Lynn has a huge immigrant population where over half the people in Lynn speak a different language at home, so that language barriers to health care and access for those folks. And what can we do working with the schools? I know Lynn Community Health Center does a lot with the local schools and does a lot with the immigrant population in Lynn to provide health care. But one of the biggest challenges is getting that to folks, getting those folks educated so that they know where to call if there's a health crisis, and that it's easily accessible to them and through their language. And I know there's a lot, some folks here from Lynn Community Health Center, I know that there are a lot of programs, but what more can we do in a community, so that especially the young people get good health care, they grow up healthy, they become productive members of our community, things of that nature. So that was a predominant amount of things that we talked about.
Great, thank you so much. Lisa's group, do you guys have a volunteer who wants to share? Another voluntold.
Yeah, I think that the other groups pretty much covered what we had talked about. We had talked about the opioid crisis. We also talked about the gang crisis in Lynn. I mean, that's the 800-pound gorilla in the room. Also, the large immigrant population that we have. And what I think the people from Partners and North Shore Medical Center have to realize is that Lynn is kind of unique, is that becoming American is a three-step process. First, when you come over, you work your tail off, put a roof over your head, food on the table. Second generation gets the education. Third generation is successful. Well, Lynn is number one. This is when they come over and they work their tails off, put a roof over their head, and food on the table. That's what we mostly have in town, as far as our immigrant population goes. And they're willing to do it. They're working hard and everything else. And part of it is the education of healthcare. They don't understand that they're bringing their old habits from home here. They're working too hard to try and learn our way. We do have farmers markets in town. Community involvement also could be, 5K runs. We have some of those. I mean, we're talking about new bike paths. It's just getting them up and moving. We're in the middle of everybody's texting. Everybody's walking around with these small phones in their hands. And it's not just a Lynn problem. To me, it's a national problem. So we're not unique. And that's about all.
Great, that's helpful. Thank you. I'll come back to the group that I was with. Do you guys have a volunteer who'd like to share? Oh, Donna, all right.
And I was way too nice to voluntold one of them. So, hi, my name's Donna. I'm with HRIA. We're the one group that didn't follow directions for that. So our group, we spent a lot of time talking about many of the same issues that the other groups have brought up. When we were talking about what are some of the top most important health issues in the community, the substance abuse as well as overall behavioral health came up multiple times. We talked about poverty and all of the other associated things with that in terms of food access and childcare and jobs and housing, and how that has an impact on everyone's health outcomes. And one thing that we spent quite a bit of time talking about was just generally fear. So fear of the unknown, fear of having to go to a new community to get your hospital care, fear of not knowing if you're a new immigrant, how to get health care and what's involved in that. So there's a lot of fear associated with things and some stigma around that people are grappling with, that awareness and education can help with, and outreach. And we also talked about how 50% of the population of Lynn is in that poverty an immigrant population, not necessarily mutually exclusive, but they're not here tonight. So there needs to be ways to reach out to that portion of the population to make sure that they're having the opportunity to answer these same questions as we are here this evening.
Thanks, Donna. And last but not least, Amanda, another HRIA representative. All right.
I volunteered. So I do have to say thank you so much for doing such a wonderful job, because you really covered everything that we talked about. We talked about healthy eating, active living in the city. We talked about the availability of fresh fruits and vegetables, transportation, the opioid crisis, education. We really covered all of those topics. So everything that was stated here pretty much was mirrored our conversation. So.
Thank you. So thank you all so much for sharing those, reporting back to the whole group. It sounds like there are a lot of common themes. You know, by the time we got to Amanda's group, a lot of things had been mentioned. So we so appreciate your input tonight. As I mentioned earlier, our next steps are to do some focus groups in the community with more community residents, as well as to conduct more interviews with stakeholders and leaders in the community. And then we will be sharing our preliminary results at the next community meeting sometime in the late spring or early summer, so that we can get some feedback on the draft findings. And so we hope many of you can join us for that next meeting. So before we close and wrap up, I just wanted to see the folks from North Shore Medical Center. Is there any final items you have before we wrap up here?
Oh, sure. I was just wondering what was going to happen with the two buildings by Union Hospital that are used basically for mental health. What will happen in the interim period?
In the interim, that's a good question. So one of the buildings that we're going to have to take down for the medical village is called Hart and Hall. That's where we have the outpatient mental health right now. That's going to move into space in the hospital proper that's currently not in use.
Okay.
And then when we build the medical village, it'll move back.
One of the pieces of information I'd like as we move forward, you mentioned the different services that would be offered. You mentioned, X-rays or EKGs, or ultrasound, those type of things, and behavioral health and treatment plans. I'd like to see the breakdown of that. Like, what will be the breakdown of services that are provided there in a future meeting, if we could get that?
Yeah, once we know a little bit better. Yeah. Yeah, I think that's a lot of what we're working through right now, exactly which services. We know some, some of the others are working on.
You've identified which ones, just how many will be represented.
Right. So for example, in the specialty services, we think right now it's endocrinology, cardiology, but OBGYN, but there's a couple other specialties we're still trying to figure out who the physicians would be and how the space would work and things like that. So we'll get back to it once we have more.
Great. Thank you all again for coming tonight. Stay safe in the snow. Oh, it looks like there's one more comment back here. For Health Resources in Action, it's hria.org is the website for our nonprofit organization. And we don't have the assessment yet, but once it's available and fully vetted, it'll be posted on North Shore's website, I believe. But our website is hria.org. Great. All right. Thank you so much for coming. Stay safe in the snow tomorrow.